It is an enormous honor, and not only because of Helen Keller's stature, her person, her inspiration, and what she inspired people with disabilities around the world, but also I'm very awed by the fact that, and honored by the people who have been here before. The list of awardees are very, very impressive, and alive or deceased, but very much admired by me. In addition, I'm honored also by the fact that in this room there are so many very distinguished ophthalmologists and old friends and family members here for this event. Now here we see my hometown. It hasn't changed much in 600 years, except that there are now 40,000 students, and so it's quite a vibrant academic center. So after my MD, I chose ophthalmology as specialty, and in Lund this was the eye clinic, and I had a residency. My thesis work in biochemistry was actually at Karolinska Institute, and there I had a very famous professor and distant guidance from him. His name was Erik Jorpes, and he had a very colorful past. 1958, I was recruited to Boston, as Reza mentioned. At the time, we had here the old Massachusetts Eye and Ear Infirmary in an old decrepit building, as you can see, and the physical circumstances were miserable. At that time, the leading successful clinician was Charles Skeppens of retinal detachment fame. He had started and built an enormous structure of clinical and research effort and collaborators to raise the attachment rate in retinal attachments from 40 to 90% over a 15-year period. He and his co-workers. And he was helpful and helped me, and he was part of the recruitment effort. And he also taught me, well, you focus on one thing if you want results. And that is what he did, and I tried to emulate with cornea. But a little earlier, 1974, 76, 74, we got a new hospital at long last. And that immediately increased the level of care massively. And it is now a very powerful institution, as you know. But then something unexpected happened. And after one of the bloody internal upheavals at Harvard and Mass Eye and Ear Infirmary, they selected me to become the next chief, to my great surprise. So they put me on behind the desk, and I was trying to sit there and look tough, but really without having much of a clue of what to do next. But except one thing, I had the vision that we should elevate the level of the culture of the infirmary to the academic level of the top Harvard institutions. And that eventually worked, but it took a lot of collaboration from my friends and took quite some time. That was the time I was administratively involved, and the recruiting of the faculty and the build up of the faculty did not go overnight. And people like Ragudas and so on, and many people were very helpful here, and we finally got a very strong and academically minded faculty. All this, of course, took a lot of time, 15 years. Was woefully little time for research. So that had to be postponed until I was out of the administration at the age of 67. So then what should I do? Well, I thought I should try to do something practical for a change, and I wanted to go back and try to see if I could work out the artificial corneas that I had started on earlier, which is not an easy thing. The concept is obvious, but to work it out into something that is halfway safe and useful is something else again. After having barked up a forest of wrong trees, I finally settled on this design, which is a collar button shaped design, and we build that into a corneal graft, and then we put that combination into the patient's eye. And increasingly, slowly, has gradually improved the prognosis and outcome. And in the non-autoimmune diseases, and there are 8 million people worldwide, all corneal blind people, it actually works fairly well. Here's an example of a successful patient with long-standing herpetic keratitis, 3 failed standard grafts, then a Boston keratoprosthesis, follow-up for 5 years, 20/25 vision, normal pressure. Fine. That is the way it should be, but of course, obviously, that doesn't happen in all cases. I will finish with a sweet little patient story that I was reminded of just the other day. And this was an early patient of mine. He was from Greece, and at the age of 11, he blew himself up with homemade gunpowder and blinded himself. And for 24 years, he had light perception only. Traveled around the world and got operation after operation. And this was the way he looked actually in both eyes, and no standard corneal transplant could help. So then we tried our window, and now this photo is taken 2 years later. Vision is now 20/25, but even the morning after the final operation, he saw 20/40. And we discharged him. We were pleased, and we told him to go down to the lobby and meet his wife. And so he was sent down to the lobby on his own. And there he was sitting and taking in this great new world that he had not really seen before. And he looked at all the beautiful women who passed by. He hadn't seen a woman since the age of 11. And among one of those women smiled at him and came up and started to talk to him. And then he realized that this was his wife. And he had not seen her before and not seen her children or their children. So I'm now almost 88 years old, and it has been a sort of a long journey, but I still have some passion left for research, and I'm not quite through yet with my profession, hopefully. But the summers are getting increasingly important for us. And here is our small family farm, actually the housing part, in the family since the year 1600. And we spend our summers there. And we have usually a lot of our children and friends and relatives and so on coming visiting us over the summer. So these summers are wonderful and hectic, but great. So I would like to thank all my teachers and all my mentors and all my collaborators and colleagues and all the fellows who have done all the work, and of course my great family, and for all the support and the guidance during my career. I owe them everything. And I think that I'd like to end by quoting Helen Keller, who said, "Help me to haste the day when no more blindness shall occur, shall happen." So that was what Helen Keller said, and I think that goes essentially for all of us. That is what we all want, and she said it so well. Thank you very much, and thank you for the honor.